In this video, I just want to show you a few ways that you can have a look at the eye, starting with direct ophthalmoscopy, starting with a distant direct. So you want to turn the wheel till you get to naught, and then you are looking through the viewfinder with your pet at arm's distance, and you're aiming to get the tapetal reflex, and you want to get that from both eyes there. Second way is looking with a otoscope. Very, very simple to use in general practice, very quick and easy to pick off the shelf, gives you a wide field of view and a reasonable magnification there, and a good bright light, so good for an initial examination of the eye and the surrounding ocular surfaces. I then go back to my direct ophthalmoscope and try to look with greater magnification. So I turn the dial up to 15 or 20. This gives a greater magnification but a shorter depth of field, so you need to get much closer to your patient in order to get the view in focus. In order to achieve that, it's important that you use your right eye when examining the right eye of the patient, and the left eye with the left eye of the patient. And to be honest, that's something I still find a little bit tricky, but you certainly get a better view when you do this. Lastly, I use my slit lamp. Mine's a pretty ancient slit lamp, still connected to the mains there, but it does the job. So the slit lamp has just much better degree of magnification than either your otoscope or your direct ophthalmoscope can provide, and so is really useful for looking at things in finer detail. The next technique is indirect ophthalmoscopy, which we're using in order to examine the fundus. Now, this was recorded during COVID-19, so Kira and myself are wearing masks, and apologies that the video shows us balancing the phone on the consulting table legs, hence you can see them all in the way. But you grab the lens and have it silver side towards the patient, and shining a bright light into the eye to get the tapetal reflex, and moving the lens into place in order to get an image of the fundus at the back of the eye. I find this extremely useful in order to examine the fundus, far more than any direct technique.